Hi. So how do we create insurance? How do we even create retainers, right? So by going to this accordion here, we have the health insurance, right? We have the insurer parts and we have the retainer parts. There are two parts, right? For insurer, we say, okay, we click on insurers, we see the number of insurers that we have, right? We can add a new one, right? And then we select the category, let's say government. Let me just give it a name and say XYZ HM, right? And relationship manager, let me say, and the address of the HMO, let's say 3 First Avenue. And primary contact phone number, let's say John Doe. His number is 080801111 John Doe. Email is johndoe@johndoe.com, right? Then click on submit. Created an insurer. But is that all? No. So after creating an insurer, so there are some actions that needs to happen. We have to map that insurer to a particular branch if it's a multi-branch location, right? Because if you don't map it to a branch, wherever those users in that branch try to click on maybe create a user or do anything that has to do with selecting HMOs, this particular one will be there. So we just need to select the branch that is applicable to, and we save the mapping, right? Now that is done. How do we now create retainers? Similar process. We click on retainer, right? Click on add new retainer. If it's private or corporate, name, and a similar process, right? Similar process. Now, once insurance is being created, once a retainer is being created, right? All of them have a plan, right? And each of those plans has a plan benefit. So how do we define the plans and how do we define the plan benefit? Although there's a video on the plan benefit and an elaborate one already, so that can be referred to. But how do we create the plans themselves? So simply click on this plan setup and click on plans, right? Now, once we click on plans, it shows all the just the available ones, and we can add a new HMO plan. Now, by clicking on the add new button, it asks us to select it, an insurer or a retainer. In this case, I'm doing for an insurer, so I say insurer. It asks us the coverage type. Is it capitation? If it's capitation, what's the capitation amount? It's 300,000 as max. If it's fee for service, we select it, right? In this case, I'll use a fee for service. Now, we have the insurer. As you can see, our newly created insurer, call it XYZ HMO. The billing structure, right? And this billing structure is also something that we'll discuss in a later video. Now, in this case, I just pick a XYZ HMO tariff, and I say the plan name is XYZ Gold, right? The plan code is optional, but let me just put in a figure here. The number of spouses, let's say 2. Number of dependents, let's say 5. The minimum account threshold. The minimum account threshold is more like the predetermined balance that a member must maintain in their healthcare account to continue accessing services. Right? What's the minimum amount? Let's say they must have at least 0 naira, right? Or should I say, let's say we must have at least 10,000, right? The maximum can be more than, let's say, 300,000. And then the age cap, if it's anybody below 50. Then you can enforce the minimum balance if you want to. Then you can also enforce the maximum balance if you want to, right? Yeah. it's the whole idea here is that this checkboxes allows us um, to restrict that, to enforce that that particular business rule is applied. This business rule here, right? Now we can also select if we want to charge the patient for registration or not. That can also be selected, right? So click on submit. Created our plan, right? Now, once the plan has been created, and that's all. So anytime um we select an insurer and there's a need to select a plan, whatever plan we've created for this insurer name is will display. Now, basically that is how we create plans. That's how we create insurer. That's how we create retainers. Thank you.